What is up, you guys? It is Jazz, and on my channel I talk about nursing, hair, and holistic health and wellness. If this is your first time clicking on one of my videos, thank you so much for coming to hang out with me today. And if you are returning, thank you so much. I really appreciate the support. All right, y'all. So as promised, I've been mentioning this video in past videos. I'm finally bringing you my Next Generation NCLEX video. This is my fourth video of my NCLEX series, so definitely go ahead and check out my other NCLEX videos, including my first video, which is all about my personal NCLEX experience, failing at 145 questions the first time, passing at 76 questions the second time. My second video, which is all about the current generation of the NCLEX, because a lot of that information is still going to apply for the current generation. For example, like the pass fail decisions, test plan content, things like that. The third video, which is just a list of 17 NCLEX tips that is very helpful for anybody who is preparing to take the NCLEX. And now finally here we are to video number 4, all about the Next Generation NCLEX. If you're looking to find any Next Generation NCLEX information for yourself, all of the information that I'm providing in this video I found at ncs-bn.org/next-generation-nclex.htm, or that's a lot, so you could just go into Google, type in Next Generation NCLEX, and it should be the first link that pops up for you. The bulk of the information that will be included in this video is actually found under the tab called NGN Resources, which that section just basically has quarterly publications that they've been publishing for years now about the Next Generation NCLEX. So what am I going to go over in today's video? First, we're going to talk about some of the biggest similarities and differences between the current version of the NCLEX compared to the Next Gen NCLEX. Then I'm going to dive a little bit more into detail about one of those big differences, which is going to be the case studies that are included on the Next Generation NCLEX. Then I'm going to be covering other item types that are new that you can expect to see on the Next Generation NCLEX. And lastly, I'm going to be going over the scoring models of the Next Generation NCLEX, because good news for y'all, one thing that has changed is the Next Generation NCLEX will be offering partial credit to some questions. One of the questions you might have is, why are they changing the NCLEX at all? And basically they are just looking for a way to better assess critical thinking and clinical judgment. So they've introduced all these new ways of asking questions, which might be a little bit intimidating, but you have to remember that the content that they're testing on is still the same. All the things that you're learning throughout nursing school are still the same things that they want you to be learning, and they're just simply changing up the way that they see if you know that information. So don't fret. It might seem scary and daunting, but you've definitely got this. Another question you might have is, when does this Next Generation NCLEX take place? Some of you who are in nursing school right now might still be taking the current version of the NCLEX, but some of you in nursing school will be taking the next generation of the NCLEX. The Next Generation NCLEX will be going into effect April 1st of 2023, so April 1st of next year. If you are graduating after that time, the Next Generation NCLEX is the one that you will be taking. Okay, so first we're going to cover the similarities between the current version of the NCLEX and the Next Gen. First off, the time limit for both of the tests is the same, 5 hours. Secondly, both versions of the NCLEX do use CAT as the exam format, which stands for Computerized Adaptive Testing. This basically just means as you go along, the computer adapts the level of questions based on how you answer. So if you answer a question right, it's going to give you a harder question next. If you answer a question wrong, it's going to give you an easier question next, and then it just keeps going along, moving up and down based on how you're answering the questions. The third similarity is that the pass-fail decisions that the test used to determine whether you pass or fail are the same. They're the same 3, and those are going to be the 95% confidence interval, the run out of time, and the maximum item. I'm not going to go into detail of all those 3 scenarios in this video. If you do want a more detailed description, definitely check out my All About the NCLEX video because I talk about it in that one. Lastly, just like the current version of the NCLEX, there will be 15 unscored items on the next generation. This basically just means of all the total questions you take on your test, 15 of those are actually unscored and don't really count towards, you know, your pass-fail decision or your performance. They basically just kind of throw those questions in to see if those are still relevant and good questions that they should be including for the test. Okay, now moving on to the differences. What are some of the differences between the current version of the NCLEX and the next generation? The first difference is going to be the number of questions. On the current version of the NCLEX, you can have a range from 75 to 145 questions. The next generation does have just a little bit higher of a range, which is from 85 to 150. So the minimum amount went up by 10, the maximum amount went up by 5. Not much of a difference, but worth mentioning. Another big difference is the presence of case studies on the next generation NCLEX. Each next generation exam will feature 3 case studies which have 6 questions or items each for a total of 18 items on the next generation NCLEX that will be case study related questions. So if you end up taking the minimum amount of 85 questions on the next generation NCLEX, that's about 21% of your overall questions, so about 1/5 of your questions that'll be coming from the case studies. And if you take the maximum amount of questions, 150, that's about 12% of your total questions that will be coming from the case studies, so a little bit over 1/10 of your questions. The next difference is question types. There are some more added question types other than case studies that you will see on this next generation NCLEX. And as I mentioned earlier, there is partial credit for some of those questions. So now we're going to get into talking about the case studies. Like I mentioned, the next generation NCLEX will each have 3 case studies on them with 6 items per each case study for a total of 18 items or 18 questions that will make up the case studies. So the NCSBN has created what they call the NCSBN Clinical Judgment Measurement Model, or NCJMM for short, which is still long. But basically this was created as a way to better measure clinical judgment and decision-making ability. So these case studies are really kind of aiming to evaluate the 3rd layer of this model. This 3rd layer is composed of 6 different parts which kind of work together in pairs to create the whole layer. And those 6 parts are recognize cues, analyze cues, prioritize hypotheses, generate solutions, take actions, and evaluate outcomes. So this is kind of like just a different way of saying, you know, the nursing process. You know, you have the assessment in recognizing and analyzing. You have the diagnose with prioritize hypotheses. You have the planning with generate solutions. You have implementation with take action, and you have evaluation with evaluate outcomes. So even though these are new words used to describe what they're trying to measure for, they're still measuring the same things that they've always been measuring, okay? The nursing process is underlying all of this. And then I would also just like to mention, they do say as well that the layer 4, which is composed of conditioning factors, which are split into environmental factors and individual factors, are kind of incorporated all throughout the case studies. And I'm not gonna go too far into the level 4, but if you do want to see more specifically how the 4th layer of this NCJMM is implemented into the case studies, they do have a publication that is specifically dedicated to that. It was the summer 2020 publication, and it is titled Layer 4 of the NCSBN Clinical Judgment Measurement Model, NCJMM for short, still long. But let's dive a little bit more into the case study. So this example is going to be from the spring 2020 publication, which is all about the case studies of the Next Generation NCLEX. So just like how you probably have done case studies like this in nursing school for an assignment, it's going to give you a nurse's notes where it gives you, the whole little patient scenario. And it says this nurse is caring for a 78-year-old female in the emergency department. Here are the nurse's notes for 10 a.m. The first step that we were talking about, recognize cues. It might ask you something like, drag the top 4 client findings that would require follow-up to the box on the right. So you're looking at this patient information and recognizing cues to figure out, okay, what are the most important things that this patient information is telling me. Then on the second question, we're moving on to analyze the cues. So once you've gone ahead and picked what you think is more important, you're going to further interpret that. So this next question says, for each client finding below, click to specify if the finding is consistent with the disease process of pneumonia, a UTI, or influenza. Each finding may support more than one disease process. So we have fever, confusion, body soreness, cough and sputum, shortness of breath. So for fever, you're gonna go ahead through and check, is this consistent with pneumonia? Yes or no. UTI? Yes or no. Influenza? Yes or no. And you're gonna do that for every single one of those client findings on there. Moving on to the third step and question, we're now prioritizing hypotheses. This is pretty much the part of your nursing care plans that would be your nursing diagnosis. This one is a closed response or drop down selection where it says, complete the following sentence by choosing from the list of options. The client is at highest risk for developing blank, and you choose what, as evidenced by the client's blank. So once again, we're creating our nursing diagnosis, prioritizing hypotheses. Moving on to step number 4, generating solutions. So this is our planning part of the nursing process. Now it says the nurse has reviewed the nurse's notes entries and is planning care for the client. See, planning, it even says planning right there, guys. This is all stuff you already know, so don't let this get you overwhelmed. For each potential nursing intervention, click to specify whether the intervention is indicated, non-essential, or contraindicated for the care of the client. So based on, the cues you've gathered, the diagnosis you came up with, you're now putting your knowledge to the test to say, what do I need to do? What should I definitely not do? And what is not contraindicated but doesn't really matter? So it says potential intervention, and for each one, you go ahead and click indicated, non-essential, contraindicated. Moving on to step number 5, question number 5, taking action. It now says the nurse has received orders from the physician. Click to highlight below the 3 orders that the nurse should perform right away. So this is prioritizing and seeing if what do I need to do first? What is my top priority? What actions need to go into effect right away? And you choose 3. Lastly, to the last question and last step of the case studies, evaluating outcomes. We've come to the last step of our nursing process. It now says, the nurse has performed the interventions as ordered by the physician for the client. For each assessment finding, click to specify if the finding indicates that the client's condition has improved, has not changed, or has declined. So I hope that I've done a good job of showing you that it's really asking you to think in a way that you've already been taught and trained to think throughout nursing school. They're really just putting different words to it, if that makes sense. This is stuff you already know how to do. This is stuff you're already doing, generating your nursing care plans and in your everyday care of patients in your clinical settings. Okay, next up, we're going to be talking about other added item types that the Next Generation NCLEX has other than the case study questions. All this information was published in the fall 2019 publication titled Approved NGN Item Types. First up, we have extended multiple response. So basically, this is another word for select all that apply, but with more answers than we're used to. This one has 8, and you still, select all that apply, but this does have partial credit scoring used in it. Next up, we have extended drag and drop. You have to select from a list whatever is right and move it to the other side. Basically, I feel like this is still just like an extended multiple response question, but it's just in a different way on the computer. I feel like the only way it would be different is if you have to put them in order. For this example question, it just says assessment findings that require immediate follow-up, so that's not asking you to put it in order. But I would assume for some of these questions, they would ask you to not only pick the responses that are right, but put them in the order that you would do them. Next up, we have close or drop down questions. This is kind of like we saw in the case study where it says it's basically 2 blanks or however many blanks and then drop down menus that you have to choose. Next is enhanced hotspot or highlighting. This is basically where there's just going to be a nice little chunk of information and you have to go ahead and highlight the most important or whatever the question is asking you. In this example, it says, what does the nurse need to do to prepare for the client? Highlighted. Next up, we have matrix or grid. This is basically where there's a bunch of columns and rows and you have to select an answer for each row. Once again, we saw this in the case study example where it was contraindicated, non-essential, or indicated. Same thing here. So potential order has different orders and you check whether it's anticipated, non-essential, or contraindicated. Now, lastly, another item type that was not included in that publication but is an item type that you might see on your Next Generation NCLEX is the bow tie item format. This one is where there's 5 boxes and in the middle it says condition most likely experiencing. On the left, you have to choose 2 actions that you're going to take based on what that condition is, and on the right, based on the action you take, you're going to list 2 parameters that you need to monitor. So basically, this is kind of just in the middle saying what is the diagnosis. On the left, it's saying what are you going to implement, implementation, okay, still using nursing process here, just asking in a different way. And on the right, parameters to monitor, evaluation, how are the steps I'm implementing, working, evaluating those outcomes, okay? This is all stuff you already know. All right, y'all, we are almost there. The last section we have to go over is the scoring models. This might be the most important because, you want to know how your responses and your answers are going to get scored on all these different types of questions. So there are 3 different scoring models that this Next Generation NCLEX uses. All this information can be found in the summer 2021 publication titled Next Generation NCLEX Scoring Models. The first scoring model is called 0-1 scoring. This is when for every part of the answer that you get correct, you get 1 point for that. And for every part of the question you get wrong, you get 0 points for that. Then all of the correct answers are added up and that's your total score for that item. So what type of item types fall under this 0-1 scoring model? Obviously, your most standard single response item is going to fall under this, where you have a question, there's 4 answers. If you answer it right, you're going to get 1 point for that. If you answer it wrong, you're going to get 0 points. The next item type that's going to be using the 0-1 scoring is the matrix multiple choice. Now for this particular one, in each row, you can only select 1 answer. So in this example here, let's look at the first row. Assessment finding, respiratory rate of 36. Is it improved, no change, or decline? They got this row right. So for that first row, they earn a point. For the second row, they get it wrong. They do not earn a point. And for the last 3 rows, they got them all right. So adding up the total for this item, they got 4 points. Next up is multiple response, where you have to select a certain number of answers. So for this one, it says select 4 findings that require immediate follow-up. So you can only select 4. You can't select more than 4. So of the 4 they chose, 3 out of the 4 were right. So they get 3 points. The next item type that is going to qualify for the 0-1 scoring is the close/drop down that we've been seeing all throughout this video. For each drop down selection, every selection you get right, you get a point. Every selection you get wrong, you do not get a point. So in this example, they got 2 out of 3 right, so they get a total of 2 points for this item. And this is the same type of a question, it's just shown differently in a table, but the same principle applies. The last item type that qualifies for the 0-1 scoring model is the bow tie questions. So once again, there are 5 boxes here, so however many of the 5 boxes you get correct, you get that many points. So now moving on, the next scoring model is the plus/minus scoring. This one is very similar to the first, except for when you answer something wrong, it's going to deduct a point. Versus in the 0-1 scoring model, where if you got it wrong, it's just 0 added points, but it doesn't deduct a point. They don't do negative, so if it ends up as a negative, it just rounds up to 0. The first item type that's going to be under this model is multiple response, select all that apply. So the difference from this and the multiple response we've seen for the 0-1 scoring is in the 0-1 scoring, they're asking you to give a specific amount of answers. Like in that first example, it said choose 4. For this, it's not telling you how much. It just says the nurse has been asked to prepare the client for immediate surgery. Which of the following actions should the nurse take? Select all that apply. So you have to just figure out how many are right. In this example, they selected 4 answers and 3 of those answers were correct. So that would give them positive 3 points and 1 answer was wrong. So that would deduct a point for a total score of 2 points, 3 minus 1. The next item type you will see with the plus/minus scoring is matrix multiple response. So once again, difference between the 0 and 1, we saw the matrix in the 0-1 scoring model when each row only had 1 answer you could select. In this one, you're gonna see that in each row, you could select all 3 answers if you wanted. So for assessment finding, we're checking if that assessment is related to these different disease processes. So appetite, they selected related to bowel obstruction. Pain level, they selected is related to bowel obstruction, appendicitis, and ruptured spleen, okay? So on and so forth. You can see the rest of the table. Now in column 1, we start at 0 points. Bowel obstruction is incorrect, so that would bring you down to -1. And pain level was correct, so that brings you right back up to 0. So for that first column, they earned 0 points. In the second column, they got 2 wrong. That would bring you down to -2, but like I said, you do not end up with a negative, so they round it up to 0. And for the last column, they got 1 correct. So that gives them a +1 point. So for this whole item, their total score is 1 point. The last item type that you will see with the plus/minus scoring model is the multiple response grouping. And this is pretty similar to the matrix multiple response, but it's just kind of displayed in a different way. So in this, we have 3 different body systems and potential nursing interventions. So for the first section, neurologic, they answered 2 questions right. So for that first row, they earned 2 points. In the next row, respiratory, they got 1 right, 1 wrong. That balances out to 0 points. In the last row, they got 2 right and 1 wrong, which equals out to 1 point. So across all 3 of those rows, they have a total of 3 points, right? Because first row, 2 points, next row, 0, last row, 1. 2 plus 1 is 3. 3 points total for that item. And the last scoring model that you're going to see is rationale scoring. This is basically like those ones that we saw in the case studies that are kind of like our nursing diagnosis, where it says this because of this or this as evidenced by this. So in this example, the client is at highest risk of developing blank, evidenced by the client's blank. For the rationale scoring, you have to get all of the parts of that item correct in order to get 1 point. If you get 1 part wrong or both parts wrong, you get 0 points. that is the end of the scoring models explanation. I hope everything kind of made sense to you. Now that we're done with the scoring models, that is all the information I wanted to cover for this Next Generation NCLEX video. I really hope that all of this information provided to you was helpful. It helped you gain a deeper understanding of what you're going to see and what you are going to be expected to do if this is the version of the NCLEX you're going to be taking. If you have any lingering or remaining questions, please feel free to comment that down below. I will definitely try and find the answer for you. And if this video was helpful for you, please give it a thumbs up, because as we get closer and closer to the Next Generation NCLEX, I have a feeling that a lot of people are going to be having questions, and I want them to find this video, which is pretty much a Next Generation NCLEX 101, where you can get all the information you need. So give it a thumbs up so that YouTube boosts this and shows it to other people looking for this same information that you were. Also, please make sure to subscribe if you aren't already, so that you can keep getting more great content sent your way from me. The last thing I want to say is just thank you so much for tuning into this video here with me today. When I say I truly appreciate every single person who watches my videos, I really mean that. So I'm really grateful for you being here today, and I hope you decide to come back many other days as well. Thank you all so much. I really appreciate it. I hope you have a beautiful rest of your day. Bye guys.